What's up, everyone? We're back. Welcome to Doctorly Unhinged. And we have potentially the best episode we've ever had today. What are we talking about today, Dr. Maxfield?
Okay, we have actually very heavy-hitting, serious topics. We have, my life updates, travel updates, that's not serious. We have the CDC warnings on vampire facials, transmissible diseases. And then we also have Walmart closing all of its healthcare clinics. And you may be thinking, like, does this actually apply to you? And really, the more we were talking about this before we started shooting, the more we realized, wow, these are actually huge topics and extremely relevant to everyone with a lot of life lessons and professional lessons, personal cosmetic lessons, all built into these stories. So there is a ton to talk about with these.
Right. So when you see a CDC update that says you can get HIV from a very simple cosmetic procedure, that can be very scary. So we're going to be diving into the details there. But quick life update from Dr. Maxfield, who finally got his way to Paris. So tell me about your experience in Paris. Was it everything that you hoped and dreamed? Did you see the building?
The building. Yeah. So it was more. I loved Paris, dude. I did not expect this. For those of you who don't know, I don't like cities. I am the opposite of Dr. Shaw in many ways. And one of them is I hate cities. I want to
Wait,
be
I hate cities too. Who said I like? Just because I happen to live and work in cities doesn't mean that I like them. They're purely out of necessity.
Okay. Okay. Sure. Right. He's Hollywood. I'm Dollywood. Like these is the matching t-shirt logos. But anyway, Paris was amazing. Like the people were great, but the whole, for someone who hasn't spent a lot of time in Europe, like it just had just an incredible atmosphere. I actually found the people quite friendly. I felt like I had a really positive experience with people across the board, locals, and with the brands I was working with. I just found the whole experience like magical. I took away some life lessons from it, like
Really?
cooking. There's just a way they operate their culture. Somehow it's like a very collectively high functioning society, and they make time for these very important moments, like cooking and the way that's built into their culture, their social structure in terms of how they like have people over to their houses. Again, I was talking to like people, I mean, all locals, whether I was working with them or just talking to them at the French pharmacy or at the store on the road. And then the cafes, like I was like, oh, this is
are
right.
elite. They have incredible pastries and croissants. Tell me, did you have any good food while you were there?
Yeah, I thought it was all good. So I knew you were going to say that. So I thought it was all good.
Okay.
This is where I feel like it probably fell short for you, because they were telling me about how the locals were telling me about how Indian food is Frenchified in France, because French people cannot tolerate heat. And that's their words, not mine. And immediately I thought, oh, Dr. Shaw would hate that.
Yeah, I mean, I think the French palate is very specific. I've been to Paris maybe 4 times now, and you know what it is? I think a lot of times I end up at tourist traps. So the places that are immediately around the Eiffel Tower tend to be bad. And I think there's a good reason why it's bad, is because they really focus more on the experience, the location, and they realize that locals are not going to return to that restaurant. And so all they have to do is capture a newcomer that's there for the great view one time, who's visiting Paris because it's a huge tourist city. So you get all these people coming in. They go there one time, they never return. Food's not good, because why would it be good? That's not a priority of theirs. So I believe that you really have to find like where the locals are returning in areas that are not touristy, because that's where you're going to find great food, because they have to recapture the local population over and over again. So of all the places I went to, and I've probably had 40 meals in France total, we went to one brasserie that I really enjoyed. And it was like a very local spot. And so I maybe I just didn't get good recommendations, but overall, like all the ones immediately surrounding the Eiffel Tower, the food, because I'm like I gotta eat a hole in the wall food, $4 platter, if it's good. That's kind of how I eat food. So getting a meal that's really expensive that just doesn't hit the spot for me is always disappointing.
Yeah, that's makes a lot of sense.
Yeah.
Anyway, yeah, trip was good. I got some great skincare. I put some up on my social. I'm gonna bring some of that with me when we're together, so we can have some fun with it.
No, I can't wait to see what skincare you got and tried. I think I got to get more details on your Paris trip in general. French pharmacy, very cool. The walking culture I really like. The
Oh, I do
cafe
too.
culture I really like nice little coffees and croissants. So good experience overall. But I think there are some things I don't love about Paris. I also always go when there's like a riot for some reason. I don't know if that's just a common
They,
practice.
yeah, there was a airport, not riot. It was a, what is it when everyone stops working in a union?
Like a strike.
Yeah. The airport worker. they they went on strike and everyone was saying, it just happens. But it's super inconvenient because people coming in missed the whole trip because they couldn't get in, and then people trying to leave couldn't get out back to get back to their patients. For me, it didn't affect me. I'm fortunate, but they're like, yeah, it happens all the time. And they were like, this is wild. It's terribly inconvenient, but it's a part of our culture. It's like, oh, all right.
Yeah, I think that's how they get what they want. So it's I think they see results when they do that, so that reinforces that behavior ultimately, and so that's how they get the government to give them what they want. So
All right.
yeah, I guess that's the thing. Quick life update for me. Let's see. I haven't done anything. I've just been kind of in the same spot. We got a new product launching from Remedy, which is like the most exciting product, I think. It's a new category that we're going after, body. We kind of teased it on social, so it's not a secret at this point. But body product is coming out. It's a super interesting product. I think people are going to love it. Comes out May 7th, pending all things go well over the next few days. But big exciting launch there. And then otherwise, yeah, I've just been focusing really a lot on Remedy and trying to work out more. So yeah.
Yeah. For those of you who couldn't see it, I don't think it was on camera earlier. I was showing him my elbows because he said they're very dry, and then he started flexing, and it was this like awkward comparison moment where I knew he was showing me his biceps. And I'm just not gonna say anything.
Yeah, I like how you didn't comment on that. Nice. Okay. So, all right, let's hop into these two heavy hitting hot. Before that, actually, we got to do our product of the day. So,
Yeah.
what have you been loving product wise? Is it something French?
It is. It's
Ooh, oui,
I actually have a
oui.
lot to pick from. But this is actually a notorious sunscreen. So spoiler alert. I'm sure we'll talk about this in detail in the future. But it's La Roche-Posay's Antelios UV Immune 400. You've brought this up on social media, at least the filter, a few times in passing. This is with Maxfield 400. It's legit. I have I know there's a couple of different iterations of this, and this one's like the ultra liquid fluid or invisible fluid. But boy, is it see-through and is it lightweight. So I'm loving that sunscreen right now.
Great sunscreen. Yeah, I think if you're in France, or Europe, anywhere really, it's a good sunscreen to grab. Unfortunately, the filter is not approved in the US yet, so you're stuck having to import that for now. But yeah, there's tons of good sunscreens in Europe that are worth trying. I think, and even a lot of the brands that we are familiar with, Vichy, La Roche-Posay, Caudalie, they all have different sunscreens in Europe than they do here. And this Europe sunscreens tend to be better, unfortunately. So big bummer for the US. I've been liking, what I've been trying is a lot of scalp scrubs. I don't know if I've mentioned this before, but I bought like every scalp scrub and tried all the ones really with the best reviews. Now, there are some really popular scalp scrubs that I did not care for at all. In fact, I thought the experience was not only not good, it was bad. And so we probably have to do a deeper dive on that. But one I did really like, and I'm still not done with my testing, so I can't say it's the best scrub ever, but it's the best one I've tried so far of 5. And this is Nature Lab Tokyo Perfect Clean Clarifying Scalp Scrub. This is a 2-in-1 shampoo and scalp scrub. And it's just overall, it's a good experience, and cleans my hair, doesn't overly strip it. The particles in it are large. I'm finding that I really like that experience a little bit better than like the microparticles. The microparticles like that feel like sand. To me, that's not a really good experience in the scalp. So that's definitely going to be user preference, but this has like big bulky particles in it. So overall, this one has been the best one. Nature Lab Tokyo.
Nice. All right.
So definitely worth checking out if you're in the market for a scalp scrub, which I think this category overall is going to take off.
Yeah, I'm envisioning this next video. I want to. I have these products I want you to try, but now I want to try all your scalp scrubs and just like do a dedicated scalp scrub video.
Did you
Because
ever try that one I had recommended, the one from Japan?
no, wait.
The Shiro?
No, I don't think it was in your shower. You left some things in there that you talked about when I visited you, but I don't think that was in there.
Oh, that one's worth trying. That's probably the best scalp scrub I've tried, but it's like impossible to find. And then apparently we talked to somebody at the store. I guess there's one in Paris, a Shiro store,
Mm,
and they said that they discontinued that product. It was like, so I don't know if
mm,
it'll ever exist again.
that's unfortunate.
Very unfortunate. All right, so let's hop into these two heavy hitting topics. We're going to first cover the CDC warning on vampire facials, and this is basically covered by all the popular media. But coming from NPR, CDC says 3 women diagnosed with HIV after receiving vampire facial. I actually believe it was 4 women and one
Mhm.
man, based on the CDC actual report. So I don't think that headline is quite accurate. And this is not new news. This is a topic that is now resurfacing because the CDC finally put out their report on this. So you may have seen the same scandal of sorts in the news over the past few years. It's only resurfacing because the investigation by the CDC is finally over. So CDC investigation of presumptive HIV transmission associated with the receipt of PRP microneedling facials at a spa among former spa clients. And this was in New Mexico. And the data they collected was from 2018 to 2023. What do we know about this? First, starting off with what on earth is a vampire facial?
So basically, this is the combination of microneedling and something called PRP. Microneedling, we're all familiar with. You actually get lots of thousands of little needles, poke holes for multiple benefits. The other side of this is PRP, or platelet-rich plasma. You get growth factors from your own blood. You spin it down, you isolate that, and then you introduce it back either by injection or onto the skin to enhance multiple benefits. It's been studied in a lot of different scenarios. You combine these two and you have your vampire facial.
Right. So simply put, we are spinning your blood down in a centrifuge, and then we are smearing it over your face. And then we use a microneedling device to basically stamp that PRP into the skin while we do a traditional microneedling procedure. And the way that this works in the office is that you can buy microneedling by itself, which is generally done over a hyaluronic acid serum. So they'll basically smear hyaluronic acid on your face, and then they'll do microneedling. Another option, which costs more money, is to get microneedling with PRP, which where we take this PRP and we smear it instead of the hyaluronic acid. And so basically, we're just stamping your own serum that we spun down from your own body onto your skin. And so generally, there's really not concerns with that about transmitting HIV if it's done correctly. And so this is where you can run into a lot of trouble. So vampire facials were really, really popular many, many years ago. Then they became unpopular, and then they became popular again. And this is a type of procedure that seems to come and go. Now, when this is done correctly, it can have quite a few benefits to the skin. But there are actually a lot of, and once I started reading this CDC article, I started to think more and more about where this procedure can go wrong that can put you at risk. Now, the good news is, and I don't think there's really any good news when a bunch of unsuspecting and unwarranted HIV infections are spreading. The good news is that this isn't like a widespread thing. So if you've ever gotten this procedure done, this is generally not something that you have to worry about. This was done at one clinic in New Mexico. There were 4 patients that were infected. They did not follow proper protocols. The clinic was unregistered. The practitioner that was performing the procedure was unlicensed. So there was a lot of things that were shady at this med spa that led to this happening. And there are a lot of ways that this could happen at any spa if things aren't done carefully. But I kind of appreciate the guys and gals who trained us more, because they were really sticklers for following proper protocol, and for good reason, because something like this could happen. So let's talk about maybe some instances along the way where you could see something like this happening, and how to avoid it.
Through the step by step of like specifically the vampire facial.
Yeah.
I mean, okay, so I guess you could say it could start with the blood draw if you had a really careless. I mean, that's the first break in the skin with this whole thing is collecting that blood. So, I mean, there are multiple instances where you're going to have needle break skin. It has to be a completely new and sterile needle, and that hopefully is an exceptionally rare occurrence these days, as needles are inexpensive and disposable, really almost every time. So that would be the first place it could go wrong.
Yeah. So, just the drawing up procedure. I mean, I think mainly to me would be, and you could say that at any lab in the country, right? You want to make sure that they're using needles. One of the things is like safety needles, but generally these, plus or minus whether or not they come with safety needles that are single, like where you put the clip on it and then you can't unclip it. Some of them have it. Some of the PRP kits have it. Some of them don't. But in general, my biggest concern would be the actual transfer and possession and the chain of custody for the blood once it's drawn. Because if you
Mm-hmm.
have a really busy medical clinic and you have several patients there that are there for PRP microneedling, aka the vampire facial, I would say the biggest concern to me would be mixing up blood samples amongst the people that are currently there. Now, I don't know if this is exactly how it happened, but I remember during our training, Dr. Crane, who trained us, was very, very specific about making sure that you never, because a shortcut would be to spin two people's blood at the same time. Because the way that the centrifuge works is that you have to offset it with this equal amount of weight, because like the way the centrifuge works is like basically it would become completely unbalanced unless you offset it with something of equal weight. And there are many slots within a centrifuge, so you don't just have the ability to spin one blood sample at a time. But he was very, very adamant that you can only spin one blood sample at a time, and what you use as your counterweight would be water or just something simple, right? So that way, it was never a chance that during the centrifuge spinning process that the samples could get mixed up. Everything was labeled properly. That's the other thing is, right, like if you put a bunch of samples and you don't label them, then who knows, right? Like it's, and then, chain of custody, like let's say that the nurse or the medical assistant or even the doctors changing between patients, that's where things I think can get really mixed up, is more on the back end than in the actual like patient room. It's like the chain of custody of that blood sample once it's drawn. And apparently, according to the investigation, when they were going through this place, there was all kinds of issues. So they found that basically that there was like needles all over the place. There was a centrifuge with unlabeled tubes containing blood located on the kitchen counter. There was medical injectables like Botox and lidocaine were stored in a kitchen fridge with food. There were unwrapped syringes found in drawers and on counters and discarded in regular trash cans. And you're really supposed to discard any needles in those like safety trash cans. They did not have an autoclave. So if they were using any type of other device things that an autoclave is something that sterilizes. So they had no means to sterilize any of the equipment. Maybe they were just using single use things, but ultimately in our offices, we all have single use equipment. The other thing is there was like extremely poor documentation. Like they didn't even really know who like came in and out of the clinic because they didn't really keep any good records of this. And so they didn't really have anything to clean. They didn't follow any proper protocol. They didn't take good documentation. And so and this was an unlicensed professional that was performing this. And so, this is really an outlier scenario, but it's kind of a lesson, I think, for everybody when choosing their provider. And I think that there's a few things that are sort of baked into our training that would have avoided this for anybody who had gone through long-term training.
Oh yeah, I mean, so the fact that you listed off all those things is like shocking and I mean horrifying in a sense. It's hard to imagine that many errors. It's actually a miracle that I think only 4 got directly infected and then a 5th vicariously infected because of how bad that sounds. Like I don't think everyone kind of appreciates the extent of this. Like if you say there was one error and that like one step in that whole chain of events or in that whole office, you're like, maybe you could say, okay, like I could see how that happens. But with all of that, that's like, I hate legal terms, but I mean, I know negligence is a legal term. Like that just sounds negligent. Like did any effort put forth to try to, I mean, follow any protocols? But again, I think again, longitudinally, we have had training. We've seen this done from beginning to end in a controlled environment, but also I even think about OR training. Like the whole idea of sterility really gets ingrained into any doctor in the OR. Because when we do even Mohs surgery, like it's actually technically a clean procedure, but we still base the standard of sterility off of our OR training and operating room exposure. And so we kind of know what the ceiling is in terms of cleanliness, and then we deliberately deviate off of that. But again, knowing where sterility has to occur and when you can utilize a clean technique or some other variation.
Yeah. So I think we're trained on all of these protocols. And then the other thing is, let's say they get the blood sample in and they spin it down. Your PRP is actually being used during the procedure. So they've drawn your blood, they spun it down, PRP comes back, you're back in the room, they're about to smear this on the face. You want to make sure that everything is labeled properly. The other error that could have occurred is that they didn't switch out the needle heads. And so and this is going to be our little segue into home procedures too, because I think this is relevant and why we stress this so much when we talk about just using clean technique and, throwing things out, especially if you're going to be breaking the skin. Another scenario that I could see this happening, and it's actually very uncommon to transmit something like HIV through non-hollow needles. So, it's incredibly difficult to do, but the possibility is, especially if you're stamping over the entire face hundreds of times, thousands of times, let's say that you didn't use a new tip on your microneedling machine, then you could have potentially transmitted it from a previous patient. Now, if they didn't do that, that's terrifying. The way that these generally come is that they're in sterile packages. You have to pull them out of the sterile packages. You have to put a new clip on it. And you also have to put like a sleeve over the microneedling device. And it's meant for a single use. And then you're supposed to throw that out. Because otherwise, obviously, there's risk of blood transmission. So there are actually a lot of those, like through a PRP microneedling procedure, there are actually many opportunities for things to go wrong. And this is why I think you really need to prioritize going to someone who is trained and expert, is not going to cut corners because, for example, like a new PRP kit and a new microneedling tip, they're expensive, right? And they add to the cost of the procedure for the provider, right? So, if the let's say you're getting the lowest budget option, they may be cutting corners in different ways that are going to cut costs from them, and then they pass those cost discounts off to you, and that could definitely increase your risk. The other thing is that, and this doesn't necessarily have to be the case, but the documentation issue is a real thing. When you go to see a dermatologist, and the dermatologist also has like an like aesthetics component to it. They generally use, it's not always true, but they generally use the same electronic medical record that they use for everybody. And they check patients in the same way that they would for a regular medical procedure, which means that the documentation is generally very, very good when you go to like an actual a med spa that's run by a physician. I'm not saying that you have to do that, but ultimately there are safeguards in place at those types of facilities that don't exist in other types of just purely cosmetic, non-overseen facilities.
Right. Okay. And I'm going to take this to, why is this relevant for you? Why is this vampire facial relevant to you at home? I actually think it starts with the idea of a derma roller. So I have become very adamant that I very much dislike derma rollers. Derma rollers are inherently fraught with multiple problems. And like Dr. Shaw said, with the in-office versions, you are going to be using a disposable head. Derma rollers not only can transmit infections from just having a dirty device and you're rolling it over skin, you didn't clean it properly, but what if somebody shared this and you're like, oh, that would never happen? I could completely see that happening. I mean, if you're a young individual, even a fully grown adult, it may not cross your mind that this breaks skin, it's been used on someone else's skin, and you are derma rolling your face, whatever, but you could easily transmit any infection from one person to another just from using some simple little home device like that. And that's why I think one of the first caveats with over-the-counter devices in general is safety. And that's why with derma rollers or any home microneedling, I will always default to the one that uses a sterile head, a sterile tip. And that's like the first caveat before I even entertain the device. And then comes the rest of it, like the effectiveness. Does it bring results? First, is it safe? If it's not, the conversation ends there.
Right. I just had a kind of random thought there about like sharing devices with like friends, significant others. Um, I think that most couples do some pretty disgusting things. I think that's pretty status quo. You know, when it comes to the transmission of germs, most couples are not very sanitary. What I have found, though, very interestingly, is like every couple will share, food, drinks, drink out of the same things, do all kinds of other things, and no no judgment here from that. Okay.
Okay.
But what I did find, and this is just from like a pure like peer polling perspective. So there's no data on this, but I'm just curious, and I'm curious in the comments if anyone maybe don't comment on this. I don't know. But what I find that most people, despite the lines that they cross in hygienes with their significant others, they will not share toothbrushes with their significant other. That seems to be the line for most people, though you could argue that some of the other lines that they've crossed are worse than sharing a toothbrush. But that being said, I'm just curious, how many of you will share your toothbrush with your significant other or person you're dating?
I might be remembering this wrong, and sorry to my wife if I'm remembering this wrong, but I think there was a period of time where she was like offended that I wouldn't use her toothbrush. And for me, that line exists. It's a hard line. I don't cross it. And the funny thing is, it's not even like a practical thing. It's just, there's something about it. It's not the germs. It's the bits of food particles. Like that's what crosses the line. And I don't know why, but it's like, yeah. We kiss, whatever, saliva crosses saliva. That barrier is gone. But the food particles, I also would not let her like dribble crumbs into my mouth from her mouth. Like the whole idea sounds terrible.
Okay. All right. Well, we know where the hard line is for Dr. Maxfield. Okay. No, it's just interesting, the things people will do and then the things that they won't do. So, yes, don't share your derma roller microneedling device with your spouse, significant other. Don't, just don't ultimately. So, basically the tale of caution here is ultimately that one good news for most of you out there is that your risk of getting HIV from PRP with microneedling is 0% if proper protocol is followed. The risk is only there if one of these things along the way breaks down, and a lot of these things are prevented by going to a credible place that is going to put these safeguards in place to make sure something like this doesn't happen. So don't look for the budget option. Do your research on who you're going to, and be the best advocate for your own health. You have to be the best advocate for your own health. Even as a doctor, I tell you this, you are going to care about, I'm going to care about you as much as I humanly can, but you are the person who is responsible mostly for your own health. Just like when I go into the doctor's office, a lot of times I have to fight for the things that I want because I know that they're best for my health. You have to fight for the things that are best for your health. So if you feel uncomfortable, you feel like you want to ask questions about something, just ask the questions. You have to be an advocate for yourself. That is how you're going to accomplish anything in life, but especially within the healthcare system, which is very, very convoluted. And we're going to be talking about the healthcare system now.
Oh boy, we're going to have a lot to talk about on this topic, but actually I think over the next year, just because of some experiences, we're actually going to have a lot more insight into the health care, industry, I think in general. And we'll try to share that with you. I would love to do some follow the money stuff, because where's that money going? It's not going to your doctor. It's not going to your nurse, and it's certainly not going to you from you. So anyway, this is Walmart will close all of its health care clinics. So this is an article published from CNN. Walmart, the largest retailer in the United States, will close 51 of its healthcare centers in 6 states, which was actually not that many. I might have thought there were more. And end all virtual health care visits. These were in Arkansas, Florida, Georgia, Illinois, Missouri, and Texas. And the whole goal, they said, was to leverage their large operations to bring affordable, convenient, low cost into underserved areas that lacked primary care options. Um, we're seeing more and more large companies do this. Amazon has, I believe, a very successful pharmacy now. I hear nothing but good things about its convenience from our nurses. And I think there was a time, and this may still be coming, who knows, Walgreens also might, or Walgreens, a lot of these little drugstores might actually also house some healthcare providers. But I do remember specifically actually when this Walmart push began. In 2020, shortly after the clinics first opened, we were in residency, and I remember this, and we were looking at the scope of what this actually might mean and who was going to be staffing it and what services would they be providing. And it wasn't just primary care. It was also, I think, behavioral health was in here,
Mm-hmm.
whatever, dental services, and then urgent care, lab work, and x-rays. Now, why did this fail? This in part failed because of, quote, challenging reimbursement environment and escalating operating costs. For me, that's where this actually hits home and I think lends towards the future of medicine. But what
Mm-hmm.
are your initial thoughts too? I don't want to jump into that ahead of anything that you have on this.
Yeah, I mean, Walmart said, quote unquote, it was a difficult decision, but its healthcare push was not profitable for the company. They said in 2020, healthcare looks like a big opportunity. However, soaring costs and access to primary care options remain persistent challenges. They chose their options because they chose their locations, they said, because they wanted to increase access to primary care in these locations. Though, to your point, when they first launched this, that was not entirely their objective. So it wasn't
Mm-hmm.
fully altruistic, obviously. And if it was, then they wouldn't close it if it was not profitable, right? So they were clearly trying to make a profit, as all businesses should. And then they ultimately said that it's different from selling products like toothpaste and breakfast cereal and requires different kinds of expertise and management. And herein lies the crux. About, I don't know, since whenever they gave me a mic to talk on social media, I have been talking about the healthcare crisis in the United States. We didn't do it much on our podcast. We didn't do it much on our channels, but a lot, anytime someone invited me, I talked about this on their podcast, especially if it was a finance-based podcast. We are in for a world of hurt in healthcare. Now, Walmart closing its healthcare facilities is just a canary in the coal mine
Mm-hmm.
for what is coming next. For those of you who are unaware of that analogy, I learned about this in like an SAT class for some reason. But ultimately, what a canary in the coal mine is they used to put canaries in coal mines. The canaries would die, I believe, and stop singing when the exposure to carbon monoxide got high. This is before they had carbon monoxide detectors. The canaries essentially would indicate to the miners that the carbon monoxide levels had reached too high. And once that happened, they would evacuate, right? So the canary in the coal mine is essentially a sign that something else is happening. And so this is just a sign of a bigger issue. We saw this when Drexel Hahnemann Health, which was the biggest provider of healthcare in the Philadelphia area to the underserved community, collapsed financially, went bankrupt. All the residents that were there training lost their jobs. All the physicians, nurses, staff, they all lost their jobs. And all of those people that were being treated by Hahnemann Health were unable to find providers ultimately. So why is this happening? This is happening for many, many reasons. But basically, inflation is going to hit the healthcare sector harder than any other sector because healthcare does not operate under free market economics. It is in a weird mixed case scenario where the government is partially involved because of Medicare and Medicaid, and then private healthcare companies are also involved. So you kind of have like a hybrid system in the United States. A lot of people think it's fully free market. It's not. And some people think that the government is very involved, and it's not. You don't generally see what's happening in the US happen when it's either full free market or full government. You really cannot, this is my personal opinion, you really cannot live in this hybrid setting without collapsing the healthcare system. And here's the reason why. Because what ended up happening, especially over the last 3 years, you'll talk to the government and will say, inflation is up 7% or something like this per year. Inflation is up 200%. I don't care what they're using as a basket of goods to determine what the cost of inflation is. The cost of housing, the cost of rent, the cost of food. You can compare the prices from even the cost of skincare up at least 50% from the beginning of the pandemic, and it's not coming down anytime soon, right? These companies are making record profits. There was supply chain issues, and they just did not cut their cost of goods after that. They didn't cut the cost of what they were selling things for, and so huge inflation overall. Why is this a problem in healthcare more than other industries? Is because let's say that you are Walmart, and the cost of rice goes up. You just sell the rice for more, and people have to buy it for more. And guess what? This is the cheapest we can sell rice for, and we increase the price because the farmers increase their prices, and that's the deal. Supply chain is bad. We increase the price. We pass it on to the consumers. End of day, we still remain the same level of profitability, if not more profitable than we've ever been before. In healthcare, because the government is involved in healthcare, they set Medicare prices. This is going to get a little bit nuanced, but what ends up happening is, like, let's say, for example, you come and see me in the office. And in the office, I bill for a general dermatology appointment, a general medical visit. That general medical visit is associated with a code, and that code is associated with a certain pay. So when you see me in the office, general dermatology appointment, not complex, that's associated with a certain code. And Medicare determines, based on your geographic area, what they're going to pay you for that code. And they determine it. So it's determined by the government. Now, why does that matter for healthcare, private healthcare? It's because private healthcare looks at whatever Medicare says and bases what they'll pay based on what Medicare does. So Medicare is considered like the gold standard or the benchmark by which all other healthcare insurance companies base their reimbursements off of. So if Medicare says we'll pay $200 for that appointment, Blue Cross Blue Shield may say, well, we're going to provide a really good service for our patients in our network, and we're going to pay $240 for that. But they don't deviate more than like 20% from what Medicare is setting as their rate. So either they set you back 20%, so they might say, okay, instead of giving you $200, we'll give you $160. Or they say, instead of $200, we'll give you $240. But it doesn't deviate much outside of this. So basically, Medicare is setting the rates for what they will pay per visit. Now, the problem is that the cost of running any medical practice, including hospital systems, have gone up substantially over the last 5 years. That's the cost of staffing, nurses, medical assistants. Wages have just gone up because guess what? When Target starts paying $30 an hour, now your medical clinic and your hospital needs to start paying $30 an hour. And guess what? There's no more money in the system. That $200 per patient visit is still the same because Medicare moves incredibly slowly to increase their rates. If anything, they've decreased their rates every single year that they'll pay per visit. So what you have is you have this piece of the pie that is unchanged within the healthcare system that's determined by the government. And everything in that pie pieces of the pie are being taken up more and more by things like staffing, like electricity, lidocaine, supplies, the cost of gas goes up and oil goes up. It's all reflected in the bottom line for those hospitals. But again, the pie has not gotten any bigger. And it's basically gotten to the point where, like Walmart said, it is unprofitable to run healthcare businesses because of this. And so this is just a sign of a bigger issue. This is why Hahnemann Hospital collapsed. This is also why a lot of medical clinics are going to collapse over the next few years unless there's some type of intervention. And it's a big deal because there's already not a lot of access to care. It's already incredibly confusing. It's incredibly expensive for patients, right? They're the ones who suffer the most in this system, but there's no more money to squeeze out of the system. And people are going to start feeling it over the next 2 years.
Yeah. And so that is actually a very thorough description of this kind of from top to bottom. But the realistic thing here is, let's say Walmart put these clinics in areas where there wasn't a lot of access. The operating margin, the profitability margin is so small and shrinking that even Walmart, this large, huge, monstrous corporation, couldn't validate this. I mean, who knows? Maybe they could even written this thing off as like a non-profitable arm of Walmart, and that wasn't even viable for them. Where does that leave small businesses? Where does that leave doctors who feel passionate about starting their own clinic because they don't want to be a part of like this monstrous system that just grows and grows and grows? Like, where does it leave the idealistic doctor who wants to build a patient doctor relationship, which are pretty much dead, by the way? I just becomes impossible. And that, for me, that's very sad. But also too, like, if you're wondering why your doctor has 5 minutes to spend with you, it's because of this. Like, because the pie doesn't get any bigger, whoever is the employer, which is almost never the doctor anymore, and it's again dictated from Medicare to insurance down, they say, okay, well, hey, you can't make money. Well, guess what? You need to see 10% more patients next year.
Yep.
What are we
Yep.
going to do to ease the burden of regulations and paperwork? We're going to increase that. And so that's really the realistic way that healthcare has evolved over the last 10 years. It's this monstrous machine, factory style efficiency model of healthcare. And it makes me very sad because I think a lot of doctors, myself included, we go into medicine and we have this nostalgic idea where we're going to make a difference. We're going to build relationships with our patients over a period of years. We're going to have meaningful conversations. And while that can be true, it's kind of done in these tiny, like, micro segments on these intermittent visits. And I've said this before, that's one of my favorite things about Mohs surgery. The surgery I do for skin cancers, my patients are awake. It's a lot for them to go through. It's like not a small ordeal, but we go through it together. I have lots of small talk with my patients for an hour on end. We get to know each other well. It's an exceptional scenario where I feel like I'm practicing medicine 100 years ago, and it's meaningful. This whole problem is not going to go away, and it's unfortunate because we care about our patients, and we care about what we do, and we care about what they go through. And I would love to see a solution. And this actually couples with another article I saw earlier today too. It's I finally found it, but it's like private equity bankruptcies in healthcare explode 112% in the last 5 years. So similarly, like, private equity is kind of their own animal. They are, it's a unique investment idea, but they can't financially keep up because the margins are so small. So whether you're a monstrous retailer or a group of rich, wealthy individuals with private equity who are trying to fund this, again, for whatever reason, like, it is not sustainable. And who is this going to hurt the most? It's going to be us. We are patients too. We're humans too. Like, I'm going to need a doctor very soon at some point, and then our patients on our end. Similarly, I'm worried about their care in the future. I'm actually legitimately worried about everyone's care in the next 20 years.
Yeah, I mean, I think ultimately the system is going to break, and out of the broken system, a new system will emerge that's hopefully better. But I don't see. I think we're on like a collision course that the train is set in motion, and our government can't get things in order. They can't pass anything unless it means banning TikTok.
That's the only
So
bipartisan bill in the last 15, 20 years.
it's the only thing they can agree on. Yeah, so I think the major issue is that unless there's some major corrective action, we're on this collision course, and the inertia is too strong to reverse unless someone steps in with completely new ideas. So I think ultimately what will happen, and just from what I'm seeing, and because we're involved in the financial end of, and I had owned my own practice when I was in Charlotte before I left to New York, and I was looking at the P&L every day. Everybody thinks that all these doctors are making a phenomenal amount of money, and doctors do incredibly well, way above what the average median income is in the United States. And I would never complain about the privilege that I have as a physician. I actually feel a lot more for my other physician colleagues and for the patients who suffer in this system, and for our incredibly hardworking staff who deserve better pay, but there's just no more in the system to squeeze out for them. So, I think, a lot of times it's like, it's tough as a physician to come off as if to complain, but really I genuinely, like, to your point, is I feel like the patients are going to get hurt the most in the system. Like I'm just thinking like, okay, my wife and I are both physicians, right? And we're going to see doctors, and they're like, well, this isn't covered because you haven't hit your deductible, right? Now I kind of know, I know what I know what a deductible is, right? But this is my wife's first time experiencing like the word deductible, even like as a physician, right? Because even as a physician, a lot of times we actually are not involved in the billing process at all. This is all done by other people, right? The doctor sees the patient, they put in the patient notes, and then everything else takes place behind the scenes, right? Like there's a billing department, there's collections, there's all these people that are then dealing with the financial aspects. Many times, unless a physician owns their own practice, they're really, really not involved and especially during training, they're not involved in the billing aspect of medicine by any means, right? So when patients are like, what's covered, what's not covered, like if you ask your physician that, almost 100% of the time, they're not going to be able to answer your question, because most of the time, if you talk to most of my physician colleagues, they have no idea how insurance works. And my wife ultimately was like, and I only know this because I had run my own practice. These deductibles, essentially how it works is, right, like let's say your deductible is $2,000. Insurance doesn't cover anything until you spend $2,000, right? Like you have to spend $2,000, and then afterwards your policy essentially kicks in, right? So for a lot of people, right, like this is a deterrent, right? This to me is a major frustration. Is the reason why the deductible exists and the reason why the copays exist is not because they need to get an extra $20 out of you. It's not because they need that extra $2,000 from you. They do that to deter healthy people and people who it's not an emergency for from going in to see the doctor. Because if you know that you have to spend $2,000 before you get to your deductible, and then even after you reach your deductible, you have to pay 20% of what you're paying, or you have to pay a $20 or a $30 or $40 copay to see your doctor, that's going to deter you from seeing your doctor unless you really, really need to go. And a lot of people will put off a very important healthcare, oftentimes preventative healthcare, in order to not have to go to the doctor so that they don't have to pay their deductible and so that they don't have to pay that copay. And so insurance is essentially made and so that you don't use it. And then there are a few people who are very ill or have chronic conditions that will use the insurance, right? And because the cost of like injectable treatments for psoriasis cost $80,000, and for some reason this is allowed, that $80,000 is coming out of everybody, right? Like, it's not coming out of the person who has that policy, because they're never going to pay $80,000 in health insurance in their lifetime, right? But it's everybody else who's not using their health insurance that is paying for that, right? So the system is like incredibly, incredibly broken, and a lot of people don't understand how it works. It's frustrating. You're already paying for insurance, but you really can't even use the insurance unless you pay more money to use the insurance with your deductibles. And so, and the entire system is really set up to harm, in my opinion, harm patients, right? And we've said this in the past, it's not the physicians. The physicians actually want to provide you the highest level of care. And you, the patient, want the highest level of care, right? There are no two people in the healthcare system that are more aligned than patient and physician, right? And back in the day, it was just patient and physician. There was the doctor that was going to the house and they were seeing the patient, and they charged the patient a reasonable fee for whatever service they provided. And it was a cash transaction, or maybe they bartered a goat for the service, and everyone was happy in the world. And now there's 100 middlemen in between that are trying to do everything they can to stop the physician from treating the patient with exactly what they need. There's a lot more to this, and you could probably tell from my intonation that I'm incredibly passionate about this particular topic, not for any of my own financial gain. Luckily, we've been very fortunate in many other ways. This is because this is a system on the brink of collapse, and if something's not done, we're all in a lot of trouble, including myself, if I ever get sick.
Yeah, exactly. This is like a human condition, the human condition. All of us are going to be affected and afflicted, and this is going to be first and foremost for everyone at some point in their lives. But
yeah, so that's a lot there, but ultimately,
it's a long rant.
That was a long rant, but ultimately, Walmart not being able to run its healthcare business. You're thinking, good, corporate America failed again. Bad, because this is a sign that there is a big issue in healthcare that needs to be fixed. Even the worst is that, to your point, Walmart has more negotiating power with health insurance companies than any single individual
We didn't
doctor would ever have.
touch
So
on that.
the fact that they couldn't be profitable when they can go to Blue Cross Blue Shield and say, actually, we want that 20% bump. Otherwise, we're not going to provide healthcare to your cohort of people, right? So they actually have incredible negotiating power. Whereas like the single doctor, like you mentioned, who's just trying to, get high quality care to a patient, unless they're in some type of corporate environment, they're getting killed because they're the ones that are getting paid 20% less than Medicare, while Walmart's getting paid 20% more than Medicare, and they can't even make it work, right? So bad signs across the board.
Yeah. So there it is, a bleak outlook on at least the near future in medicine. We'll see what's on the horizon. Hopefully we have some revolutionary good news at some point to deliver. Who knows? We'll delve into this a bit more, share a bit more with you about our experiences this year. Hopefully we'll have some solutions, some help. But anyway, we're both passionate about this topic. Very skincare light today, a lot of warnings and foreshadowing. But we did shout out 2 good products that you should use. I don't know, but these are very relevant, very important topics. So I think it's very meaningful. And hopefully this provides people some insight into what we experience, what we see. And then also they can kind of, at least for their cosmetic procedures, tread softly and safely as you pursue anything in the office.
100%. Well, in this bleak episode, we will see you next week with hopefully some more positive information. We'll put, I'll if I can remember, I'll put a link to sign up for the wait list for the new Remedy Body product that's coming out. And otherwise, I will see you all next week. Thank you all so much for your trust and support, and we will see you in the next episode.
Yes, we will see you next time.